Hi, welcome to this edition of the Community Dialogue. I'm Liz Forrest, and today I'm with Marcia Holsinger, and she is here to tell us about the SHIIP program that we have available. So first and foremost, can you let us know what is SHIIP?
SHIIP is SHIIP, and it is an acronym for Senior Health Insurance Information Program. And what it is it basically provides a free, objective, and confidential information and educational material for folks that are Medicare beneficiaries or becoming old enough to be on Medicare to help them sort through the confusion of Medicare. It's very complex, so that's what SHIIP does.
Wonderful.
To kind of give you an idea, here in this area, we are throughout the state of Iowa, but here at Jefferson County, we provide that service over at Jefferson County Health Center.
Okay.
So if you need to call our number, it's 641-469-4308, and leave a message and we will call you back.
Yeah, because you guys aren't always on site.
We are not on site.
Okay.
We're only there for appointments.
Okay.
Yeah.
All right, and then how many of you staff this here in Fairfield?
There are 4 of us right now
that
are trained and certified through the state of Iowa. In Iowa, there's probably about, I think, 360. They're training some new ones since COVID, training a lot of new ones coming this summer. But they just train once a year statewide, and I don't know how many nationwide we are. But
wow,
yeah.
Say a lot, I would imagine.
Yeah, yeah.
But probably not quite enough to fulfill the need.
It's hard to say whether we're completely filling the need. I know we see collectively this past year we saw nearly 800 contacts for the 4 of us. Most of that was done during the open enrollment. In Iowa, if you don't know, there's 565,000 people that are over the age of 65 on Medicare. And there's several others that are under age 65, disabled, and on Medicare. Wow. So there's a lot of people that are drowning in a sea of information and are not well informed, and that's why we have SHIIP.
Yes, what an amazing program. So when you work with people, do you work with the individuals themselves or do you work with families? How does this look?
Most of the times here we've mostly worked one-on-one with individual folks, but we'll work with couples that are coming in. Sometimes it's helpful to have more than one person hear what we're saying and collect the information. A lot of times one spouse over the other is more in tune with what's going on. Yeah. We work with families in terms of maybe children whose parents are on Medicare, maybe in nursing homes or other facilities, and we will work with those people that in that regard. We've done a lot of on-phone counseling, especially during COVID. It was all over the phone, emails or mail. And we got through the years of doing that, but now we're back at the hospital, so that's much better.
Yeah, that one-on-one interaction, and sometimes it just helps to facilitate. Yeah, wonderful. If you could highlight a few different areas, like what are the different areas that the SHIIP program covers? I know that you had some different pamphlets, and one of them kind of covered fraud in addition to that. Can you kind of let us know like what different areas the SHIIP program helps people with?
Primarily, we help people with understanding Medicare, the benefits that Medicare has. Medicare is divided into parts, and there are options for getting your Medicare. There are basically 2 options. There's original Medicare, provided Medicare is the federal health insurance for elderly people, and the other one is Medicare Advantage plans, which are giving your care of Medicare to a private insurance company to manage it for you. Those plans are a little more restrictive than original Medicare, and we go over those options and the benefits either side, and that's kind of what we do. Probably we need to mention that we do not sell, promote, endorse, or recommend any particular agent, insurance company, or any insurance product. We are not affiliated with any of the insurance industries, pharmaceuticals, or financial industries.
Perfect.
We don't make decisions for clients.
Good.
And we're not responsible for the decisions the clients make.
Yes.
So
purely there to help provide the information and educate.
Yeah, we really guide them. So it's mainly talking about the benefits, the options they have, the benefits on each of those options, the costs that come with that, the difference between the different plans, and then I would say probably how to enroll, where to go to enroll, and the time frames. There are enrollment periods for each parts of these, and each of them are time sensitive.
Yes.
And so that's critical, is that come get the information ahead of time so that you don't miss a deadline.
Yeah, for sure.
Yeah.
Wonderful. What other information do you have to share with us about the SHIIP program?
Our referrals mainly come from healthcare professionals.
Okay.
Sometimes the Jefferson County Health Center admissions office will have folks stop by their desk. We will get them from caseworkers, Department of Human Services. Pharmacies will send folks our way. Word of mouth is a big one. We have relatives and friends of prior or current clients. The state SHIIP office will send out a brochure, and usually to new Medicare folks.
Yeah.
But that's where most of our referrals are coming from. I don't know that I mentioned that this SHIIP program is a federal program.
Okay.
It's throughout the entire country, but the federal government gives the money to the state. The state manages their own SHIIP program. In Iowa, we are managed under the Iowa Insurance Division.
Okay.
Some states it's going to be under Department of Human Services, some of it's under the Department of Aging,
Okay.
but ours is not. And we are the only state SHIIP organization that has two I's in their SHIIP name.
Really? Okay.
So that differentiates us from all the others. They all have kind of acronyms all over the country. Each state is different, so they have different rules. So it's kind of one of those things where you have to be well trained and certified in Iowa to do the Iowa SHIIP program. We will work with folks one-on-one. Usually we can answer a lot of questions over the phone.
Yeah.
But if need be, since there's 4 of us and we share an office, we each take a day that we get to schedule our appointments in the office. We each take a week at a time that we check the answering machine for phone messages, and then we will call you back from our own cell phones. Actually, 3 of us don't live in this county, but we all used to work here. So
yeah, very familiar with the community.
Yeah, we're familiar with it, probably more so than where we live.
Yeah, right? As you spend all your time here.
That's right. That's right. So that's kind of the part of it there. Yeah, we are located at Jefferson County Health Center, behind the admissions desk right now. We've been moved from office to office over the time, but we just move in and get
to work,
get settled in and go with it. We're very, very grateful for Jefferson County Health Center to provide us with an office, a phone system, the computer system, all the office supplies we need to conduct our business with SHIIP clients. I think I mentioned earlier that we've been here, I think it started in Jefferson County about 1998 or 99.
Okay.
So we're in our 24th year at Jefferson County Health Center.
Wow.
SHIIP offices can be in a lot of different public places, libraries, senior centers, nursing homes, I suppose, if they've got the capacity to do that. But since most of the clients in Medicare usually are using Jefferson County Health Center, that kind of makes sense. Yeah. The biggest part of what we do, I think, is in the fall. The open enrollment period nationwide is October 15th to December 7th.
Okay.
It's a 7-week period of time where Medicare beneficiaries have an opportunity to join a plan, change a plan, switch plans during that time, and it would become effective then on January 1st.
Okay.
And mostly what we actually deal with are the prescription drug plans and the Medicare Advantage plans right at that time, but mainly prescription drug plans. And a lot of people will say, I take the same drugs and I like my plan, and that's just fine. You do not have to change.
Okay.
But all of these prescription drug plans and Medicare Advantage plans in Iowa or nationwide, they're required to send you a letter in the fall. Usually late September you'll get it. And they're going to tell you what they're going to charge the following year and where they're going to categorize different medications and what those copays are going to be, what their premiums and their deductibles and their copays are going to be. You can continue with that just fine, and if you do nothing, they'll just continue you on.
Okay.
But it's helpful to look, because sometimes they will drop a medication that you might be on, or they up the tier level, which means now you
pay more.
Or they change. They make deals with pharmacies.
Okay.
So that there are preferred pharmacies that will give you a better price on your medications.
Okay.
We have all that information.
Yeah, like you're a wealth of knowledge.
Yeah.
Insurance is very tedious and
that it
overwhelming
is.
for many people.
Yeah.
But having somebody who essentially is kind of an expert in all of this stuff, being able to kind of give you that info and navigate through is so beneficial and so helpful.
It is. And I think in 2021, we saved Jefferson County residents that changed their drug plan. We saved collectively $146,000.
Wow, that's amazing.
Statewide, $38 million. That's what SHIIP counselors did. So it's kind of important to look at it. Even if you don't change, you don't have to change. You don't have to look either, but be prepared.
Yeah.
Because there could be changes.
Absolutely. Yeah. And, you know, every year there's something that seems like that changes with people's health plans, whether it's regular insurance or the Medicare. So
the other thing is, I think that's kind of important is during that time period, there is a lot of folks that are not as honest as they should be, and so that's the other thing we do is try to educate Medicare beneficiaries to protect themselves against fraud.
Yes.
We will advise our clients not to carry their Medicare card with them like their driver's license. They don't need it every day.
No.
You are allowed some time to get that number to a facility if you happen to run into an emergency room. If you're going on a trip or you're going to be out of town or something, then that makes sense. Or you go to the doctor, take it with you, but not as an everyday thing. If you do have a situation where you're violated fraud, you can call Medicare, you can call us. We will file a case report with the state of Iowa, and they'll do an investigation. It is a federal offense. But that is one of the things that we warn people about, is to protect that number. Be aware there are callers that will call you. Insurance companies are not allowed to cold call you on the phone.
Yes.
Okay, so, and Medicare and Social Security will never call you. They'll never call you. And people that are wanting to fraud others will call, and they'll say, did you get your new Medicare card yet? And can you verify the number? Do not give them the number.
Never.
Never give them the. If it really is Medicare, think about it. They already have your number. And if you really have a doubt, take the number down that they gave you, their phone number, but don't call it. Call the Medicare number and say, did you call me?
Yes, absolutely. It's so important for people to protect their identities in all aspects. And this is a great speaking point, because I know sometimes people are assuming that, oh, I need to give you this information. But yes, they should have that, so don't fall prey to the scammers.
The fraud, there's a lot of it out there, unfortunately. And I think because of the age of people and the honesty that the older folks kind of feel, I think that they become more of a target. But that's why we're here to try educating folks to be protective of their numbers.
Yeah, so don't ever give those out. What else can you share with us in regards to safety for the seniors when it comes to information such as this?
Well, there have been other fraud cases in terms of folks getting their insurance changed without their knowledge.
Oh.
That's happened a couple of times. But a lot of times some of the calls come in and want your Medicare number because they have free COVID tests.
Oh, okay.
Well, COVID tests are free for everybody, so they don't need a Medicare number. A person over the phone doesn't need a Medicare number to send it.
Yeah.
We have had people that receive back braces, and they'll get a phone call, and the person on the phone wants their Medicare number, or they're going to charge you for the brace. The brace did come to the door.
Interesting.
Interesting, yeah. So what we found on that one is that the doctor who prescribed it was in Florida, and so they tracked down the clinic down there, and he doesn't work there anymore.
Oh, wow.
So, and they start getting these, and the person's not going to be charged with it, but Medicare will be.
Yes.
So Medicare's losing a lot of money just because of all these fraud things going on. So you just really have to be aware.
Yeah, absolutely.
The other one was genetic testing.
Okay.
That was another one, DNA, and it's kind of popular right now too, but I haven't had any cases on that one myself. But you just have to be really, really careful.
Yeah, absolutely. What an amazing program that you have, brought to the community, and, to bring more information to everyone so they know that this is a resource that's available right here. And, it's just a phone call away and an appointment. And I know you did say that you guys are very, very busy when it comes time for this open enrollment.
Yes.
Yes. So is there anything that you could suggest or any information that you would put out there to help people prepare for that in case they weren't able to meet with you for one of those?
There's the Medicare website, which is medicare.gov.
Okay.
G-O-V. You go into that site, you set up your own account, username and password, security question, and then you can go in and update your drug list, your prescription drug list. Go in and pick your pharmacies and then hit the Find Drug Plans, and it will populate all the drug plans. You can set it by company, or you can set it by lowest cost, premium and copays together, and it will populate it up with the cheapest one on top. Okay. And then you look inside each plan to be sure that they cover all your drugs, because it might be cheapest, but maybe they're not cover 4 of your 7 drugs.
Yeah.
So you want to make sure they cover all of them, and there are also restrictions. So maybe you need 60 of those pills in 1 month, and they're only going to cover 30. So you need to make sure that that is the right drug plan for you.
Yeah.
And that's what we help people do, is sort through that.
Yeah, wonderful. And that's a great, little bit of information too, to know that you can access that online. So if you have someone who lives here in town and family that's out of town, potentially they can come in, if they're not able to make it into that appointment, they can take that information and from afar utilize that to help them as well.
And then they can enroll themselves.
Yes, absolutely.
They can do that. That generation, I'm part of that generation. We're not computer literate particularly. So that's why folks come in to see us, and we can navigate through the system because we will take a full day training prior to the open enrollment period, like about 5 or 6 days ahead, to get the updates for the following year, and then we can kind of work through it with folks. That's what we do. That's probably the biggest bulk of what we do. Yeah,
so being up to date, consistent, knowing all of the new material that's come out and everything that's changed. So we were talking, it's kind of like taxes, and you need to know when you're getting all of those things right. So, all right, is there anything else that you can think of to share with us? Or
I think probably to know that Medicare is not automatic. You have to enroll in it unless you started taking your Social Security prior to age 65.
Okay.
Then Social Security will automatically enroll you in Medicare. If you are 65 and want to continue working and staying on your employer plan, you can do that. But maybe you want to find out if you want to get in Medicare then or wait till later. Or are you on your spouse's plan and your spouse is continuing to be actively working and you want to bypass getting on Medicare at that time. Those are kind of another population of people that we work with, is working beyond age 65, whether you stay on Medicare or not, or get on Medicare or not. Know that Medicare doesn't pay for everything. They do not pay for hearing, vision, or dental. There are other plans out there that will for folks over age 65. There are Medicare Advantage plans that will cover some of those benefits, but they are not Medicare, and those benefits are not guaranteed.
Okay.
So you have to be careful about, and the provider has to be in the network of the plan you join and so on. There's a little more criteria to, is that a good plan or not for that individual. I think it's important to know that Medicare is not free. There are costs. And what are those costs and when to enroll, how to enroll. I think probably the other thing that's helpful to know is that we also provide a way to apply for financial help, financial needs. The state of Iowa has limits for income and resources, and if you fall into below those limits, then you can apply for financial need to help you with your Medicare costs. So we're the person that can get you started and steer you in that direction as well. I think that's kind of an important thing as well. The rules keep changing.
Yeah.
We stay on top of it. Our state office sends us emails. Know that everybody is different. You might be having coffee with your friends and finding out what they have on Medicare, or you might be, playing cards with somebody, or you talk to your friends you have, and you can do that, but we want you to come and talk with us and get the information so you know what all your options are, because everybody doesn't wear the same pair of shoes.
That's right. It's not a one-size-fits-all.
It's not a one-size-fits-all, and everybody, it might work for them, and that might work just fine for them, but maybe it might not work for you. We don't know. It might. Who knows?
Yeah.
But that's kind of a big piece of it as well.
All right. Well, that sounds amazing. So for anybody who is looking for this information, we'll have some info posted with the video as well.
Yes.
So we'll have that. And I want to say thank you so much, Marcia, for coming and explaining this wonderful benefit that the community has and this amazing resource. So,
Oh, thanks for having us.
yes, thank you so much.
So call our number if you need some help. We'll be glad to help.
All right, perfect. Thank you.